Hi Tate, how are you doing today? My name is Matt. I'm going to be your intern here. What seems to be bringing you in today? You've said some stuff about low back pain in the past, but recently it has been feeling a lot better, and I know you've been having some leg pain. How are those things doing for you right now?
My low back pain is getting a little better, but at its worst, it's really severe, and it's really stopped me from doing some of my daily activities, as well as my leg. It's really inhibited me from playing basketball and doing some of those things that I like to do.
Is there anything around the home that it's preventing you from doing right now?
Just doing my daily chores, as far as mowing the lawn goes, sitting down on that lawnmower for long periods, it's just really not doable at this point. And the leg also, that pain down there, kind of keeps me in bed.
Okay. Yeah, these are definitely some things that we would like to work on in getting you back into the daily swing of things, as you will. We definitely want to address the lower back pain. Like up here, if we take a look, we've got a spine, and you see all these bones and these little purple discs here, and we've got nerves running in and out of all of these, and we see that sometimes they get a little bit pinched if there's a little bit of degeneration or rotation in the spine, and it kind of cuts off the flow of electrical signals to that point of the body, so it makes it harder for those things to move. It makes them get sensations of soreness, and sometimes, if you can see on this chart, it even can affect your your intestines, your colon, and your muscle groups. So there's a lot of different things that could be contributing to this low back pain. And some of the things that we've done today, we did some tests, like we did the Kemp's test for you. Remember when we had your hand on the back of your thigh and you leaned back? You started getting some pain in your back, so we definitely want to check that out. And we did that belt test where I supported your waist, and we found that you were getting pain when there was when the waist was supported and when it wasn't. So that was really indicative of some of those low back issues, which a lot of people have, and we've seen a lot of success here. So we're going to move forward in our treatment, as we've been speaking, where we're going to do some physical therapy with you. So we're going to use some modalities like some cold laser around there to try and break up some of the adhesions that we might be seeing. We're going to talk about using that thumper that kind of gave you a nice little good massage.
Yeah, that was very nice.
Right, and then it loosens up some of the tissue, and then it'll make it easier for when we're going to be delivering some of these adjustments for them to set and for them to hold for longer periods of time and to get you back on track with your life.
That sounds awesome, Doc.
Right, so if you look over here, we also have your x-ray, and you can see that kind of this bone right here, it's kind of tilted off to the left, and it's kind of closing down on that side of the nerves, and it's kind of causing a little bit of restriction in some of that movement and some of that sensory pain that you've been feeling in the lower back. And also here we've got a couple little bone spurs, and those could also be pressing up against those nerves and just causing a lot of irritation in general. But if we can get that straightened out, I'm really hoping that we can give you some relief, and you can get back to some of your daily activities that you've been talking about. Maybe you can run for a little bit longer at a time. Maybe we can retrain some of those muscles with some of the tests that we were going to give you for the core strengthening. Mm-hmm. We'll get your back straightened out, and we will get you just in better physical condition, and in all likelihood we will get you better than you have been in a long, long time. So you'll be back out on the court, and you'll be dunking on top of all of your friends, and you'll just be feeling like your old self. So is it correct that you haven't seen anybody else for this in the past? This is your first option. This really makes you feel like you're gonna have a good experience here.
Yeah. So, like I said before, I did go actually see one medical doctor, and they had recommended surgery, and they just wanted to load me up on drugs, and that's just not the route I want to go. I want more of a holistic approach, and I just felt like after talking to you and meeting you out at that screening, that you were just the right way to go, and you made me feel very comfortable in what you were going to do with your care.
Okay, well that's good. Yeah, I have had surgeries in the past myself, and they can work out to an extent, but you just never feel quite the same, and there's a low success rate with these things. I mean, we're talking 50-50 sometimes on some of these surgeries on whether or not you're going to feel better, and that's a big risk to take to be dealing with your body in that way for the rest of your life. So what I'd like to do here is have you come in for the next 6 weeks for 3 visits a week, and you're in this. We're in this stage where we're really trying to rebuild your posture and try and make things set correctly and hold for as long as possible. And if I feel like we're moving along at a really good rate and you're making excellent progress, we can adjust that schedule to maybe you'll come in maybe 2 times a week. But I think for the beginning anyways, we need to be seeing you at least 3 times a week for 6 weeks. And then after that, we're going to adjust down to probably about 2 times a week for 3 weeks. And then maybe just 1 time a week. And then eventually maybe just once a month for maintenance, just to keep you in this in the shape that we're going to get you into. And that way you will be able to have like a really good experience with us, and then go home and translate that into your life, getting back to your daily activities, playing with your nieces and nephews, going out and playing basketball with your friends, mowing the lawn. That's stuff that should be easy for you to do on a daily basis.
Definitely. Well, Doc, it sounds like you have a really good diagnosis, and it's something that I'm willing to commit to.
All right. Well, I look forward to working with you on this, and let's get started.
Perfect. Thank you so much.